Hi, my name is Dr. Vicki Fischer and I'm a pediatric optometrist. In this video, I will show you how to perform a distance vision screening on any age 3 years old and older. I'm going to demonstrate the vision screening in a school because screenings are most commonly done in schools and pediatricians' offices. Although I will frequently refer to students, this technique can be used in adults as well. However, detecting vision problems in children is especially important because, number one, poor vision affects school performance since 70 to 80% of what we learn is visual. Students need good vision to read, write, see a computer, or a school board. Number two, permanent vision loss can occur if certain vision problems are not treated before the age of 6. In general, the sooner treatment begins, the better the outcome. Remember, vision screenings can miss many problems. If someone has symptoms of a vision problem, such as loss of place or difficulty reading, headaches, squinting, frequent blinking, red, tired, or watery eyes, they should be referred for a complete eye exam. Now I will do a brief demonstration of distance vision screenings, so you can easily review this video before your next screening. After, I will discuss vision screenings in more detail. Let's begin.
Hang the eye chart at the eye level of the average student. I recommend using blue painter's tape since it will not leave a mark either on your walls or floor. Measure the test distance indicated on the eye chart using a measuring tape. Place a line of blue tape on the floor at the proper test distance. Place another line of blue tape on the left side, forming the letter L to help you remember to cover the left eye first. This is an example of a proper setup. Make sure the room has good lighting. Now it's time to tell the runner to get the students.
Good morning, class. We're leaving for the vision screening now. If you have glasses, remember to put them on.
Keep your chart clean. Do not point with the tip of a pencil or pen or anything that can mark the chart. Point with a pointer such as a pickup stick or the end of a pen. Point below the letter about a ½ inch and quickly remove the pointer. Store and travel your chart protected, such as in a cardboard mailer.
Step on the center of the blue line. Cover your left eye with the palm of your hand. Don't use your fingers, use the center of your hand. Perfect. There are two main methods to use an eye chart to measure distance vision screening: threshold method and modified critical line method. In threshold vision screening, tell the student to cover their left eye with the palm of their hand. Point to a letter on the top of the chart and ask them, what letter is this? If correct, continue down the right side of the chart, briefly pointing to one letter in each line. When they make a mistake, go back to the line above and ask them, tell me the letters in this line. Continue down the chart until they miss 3 or more letters in a line. Record the last line they can read 3 of the 5 letters correctly as the visual acuity. Now ask the student, cover your right eye with the palm of your hand, and repeat the same procedure with the left eye moving down the left side of the eye chart. The student must be referred if they cannot read a majority of the letters in the pass line, or if there is a 2-line difference or more between the eyes. Now tell me what letter this is.
Z, C, S, K, D, H, Z, N, X.
Read this entire line.
K, N, O, Y, X.
Good job!
An acuity of 20/20 is reported because 3 of the 5 letters were read correctly. The right eye passes.
Now cover your right eye with the palm of your hand. What letter is this?
H, R, Z, S, H, O, X.
Read this entire line.
N S O V K.
Very good. Read this entire line.
X D Z K H.
Good. Read this line. That's
Uh,
okay. Just try your best.
I can't see it.
Okay, good. You can take your hand down.
Although the left eye passes with an acuity of 20/30, the child still needs to be referred due to a 2-line difference between the eyes.
In a critical line screening, the student will read only the passed line. If they can read 3 of the 5 letters correctly, that eye passes. If they cannot read at least 3 of the letters correctly, then they must be referred. Although the critical line is the fastest method, I don't recommend it for 2 reasons. Number 1, you can only record the eye as pass-fail and not the level of visual acuity. Therefore, you can't determine if there's a 2-line difference between the eyes. The second reason is the student will hear the other students read the line and unintentionally memorize the line. A modified critical line screening will help avoid these problems. In a modified critical line screening, you will ask the student to tell you the letters in the first or second line to see if they understand the test and to get them warmed up. Then ask them to tell you the letters in the critical line, either forwards or backwards, to prevent memorization. If they get the answer right, move down the chart on the same side. Record the last line they can read 3 of the 5 letters correctly as the visual acuity. If they can't read the letters in the critical line, then move up the chart until they can read 3 of the lines correctly. You can also let them go down the chart again in case they just needed some time to warm up. Record the last line they read 3 of the 5 letters correctly as the visual acuity. Just like threshold screening, the student must be referred if they cannot read the majority of the letters in the passed line or if there's a 2-line difference between the eyes. Cover your left eye with the palm of your hand. Good, that's perfect. Read this line of letters.
Hovness.
No, just tell me what the letters are.
Sorry. H O V N Z.
Good job. Tell me this line of letters.
S V H K Z.
Good, and the next one?
R N O Z V.
And the next one?
C S R K N.
And the last one?
K N O V H.
Perfect. Now cover your right eye with the palm of your hand. Can you tell me this line of letters?
S R K C H.
Excellent. Can you tell me this line of letters?
S.
Now keep your eyes open really big. With your eyes open big, can you read the letters or no?
No.
Okay, that's fine. How about the line above it?
R.
Keep your eyes open really big. How about the line above that?
K S Z C V.
Excellent. Can you read the line below it?
No.
That's okay. You can take your hand down.
The right eye passes with an acuity of 20/20. The left eye has 20/60 and the student must be referred.
In kindergarten and second graders, a screener needs to sit next to the child to occlude their eye for them. It is helpful to have a second screener to point to the eye chart, but you may also use a laser pointer. We're going to play the shape game. This is a circle, moon, star, heart, triangle. Can you touch the circle? Say circle.
Circle.
Good. Say moon.
Moon.
Good. Star,
Star.
heart,
Heart.
triangle.
Twice.
Excellent. Can you tell me what shape this is? Which one is it here? Which one's the same? You're right, that's a circle. Can you tell me what shape this is? Just find it over here. Good, it's a triangle. Can you tell me what shape this is? Very good. Now I'm going to cover your left eye, and can you tell me the shapes in this line?
Heart, moon, circle, triangle, star.
Good. Can you tell me the shapes in this line?
The heart.
Keep your eyes open really big. What's next? If you forget, show me which one it looks like over here. Which one does it look like? You're right, it's a triangle. Can you tell me what's next? What's after the triangle? Good, it's a moon. And what comes next? Circle, excellent. Now tell me the shapes in this line. Heart, good. Circle, good. Moon, triangle, and star. Excellent. Now keep facing all the way forward with your eyes open really big. Can you see those shapes? Moon. Good. Star and... All right. Good job. Tell me the shapes in this line.
Moon, star, triangle, circle, heart.
Very good. Can you tell me the shapes in this line?
Circle,
With your eyes open really
circle,
big.
circle, triangle, circle.
Very good. Now go to the line above it. Can you read this line?
Circle, triangle, star, heart, moon.
Very good. Let's give this line a try again. With your eyes open big, can you see it?
All I know is that it's circle, 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 triangle, circle.
Very good.
The right eye passes with an acuity of 20/20, but the left eye has 20/60 and the student must be referred. Clean, reusable occluders with alcohol before each use, such as reversible occluder glasses and spoon occluders. You can use disposable occluders to prevent infections such as a tissue under a pirate patch, a Freddy the Fish occluder, or simply a paper towel held over the eyes. Now I will go into more detail about vision screenings. The reason I became so interested in improving vision screenings is I go to schools with a nonprofit to give free eye exams and glasses to students with financial need who failed vision screenings. I wanted to make sure that every child who needed glasses could get them. I noticed some schools and pediatricians' offices got great results. Almost every child who failed the screening needed glasses. But other schools and pediatricians' offices, many children passed that needed glasses, or many children were referred who were normal. In general, the prevalence of vision problems is about 10% in kindergarten and first grade and 25% in 2nd to 12th graders. That means if you screen 100 kindergartners, about 10 of them should be referred. And if you screen about 100 second graders, about 25 of them should be referred. So I started going into schools and pediatricians' offices to see how I could help them improve their vision screening. One of the most common mistakes is not using the exact test distance. Old Snellen charts require a distance of 20 feet, and the results were thrown way off if the blue line was moved just a few inches forward to accommodate a smaller rune. Newer, more accurate Sloan charts are calibrated for 10 feet. The 2200 letters should be 3.5 inches high for a 20-foot test distance and 1.75 inches high for a 10-foot test distance. That means the letter has to be double the size for a 20-foot test distance. Some of the eye charts I saw even had letters or shapes that were not even the correct size. As a side note, even on a 10-foot chart, I recommend writing the fraction using the 20-foot notation. For example, write 2040 instead of the equivalent 1020 to avoid confusion. The Snellen chart was created in 1886 and hasn't changed since. In the 1970s, the ETDRS chart was accepted as the new gold standard for research. ETDRS uses Sloan letters, which blur better than Snellen. Each line consists of 5 letters to test for a majority. The spacing between both lines and letters are equal to 1, and the ETDRS uses a 10-foot test distance, which makes testing more convenient. I created my own version, the Fischer chart, based on the ETDRS chart, with small differences to make it more convenient for screenings. Both charts use Sloan letters, a 10-foot test distance, have 5 letters to a line, and spacing equal to 1 between each letter and each line. The difference is, on a Fischer chart, there is a 20-30 line instead of a 20-32 line because that is our pass-fail criteria in Florida and many other states. The ETDRS chart is much bigger due to the logarithmic progression of lines at the top. The Fischer chart is not logarithmic on the top third since it doesn't affect the pass-fail criteria in a screening. This makes the Fischer chart smaller and more convenient to hang and travel with. Also, for a screening, it is unnecessary to go smaller than 20/20. An ETDRS chart goes down to 20/10 or 28. On a Fischer chart, I included right and left columns to prevent memorization. I put crowding bars around lines to make amblyopia easier to detect, and finally, I made the acuity numbers big and easy to read from a distance, and I put a simple to understand green pass refer line. The worst charts I witnessed were the kindergarten and first grade charts. Here are some examples that explain what to watch out for. Avoid the tumbling E chart since kinder and first grade still get confused with rights and lefts. Spacing should be equal to 1 throughout the chart and not get white spaced at the bottom, such as this. On this chart, the 20/40 line was left off, which is a big problem since it's the passing line. Avoid laminated charts since glare can make them difficult to read. Color vision and acuity cannot be tested together. Avoid charts where children have to come up with a name for something, such as a flag, umbrella, car, phone, or horse, because it is difficult for all young children and can introduce cultural bias. The HOTV chart has a matching card, which is good, but the letters HOTV don't blur out well, which isn't so good. Here are good charts for kindergarten and first grade. The Fischer shape chart is on the right, and I included the same changes to make it more convenient for screenings, like the reverse side with letters. There's a 10-foot testing distance, a column for the right and left eyes, 5 shapes per line, crowding bars around each line, and spacing equal to 1 between each letter and each line. The most common cause of decreased vision is a simple refractive error such as astigmatism, myopia, or hyperopia. The blurry vision is easily corrected by glasses or contacts. Refractive errors are caused by a very slight deviation in the shape of the eye. In emmetropia, the eye has a normal shape and light focuses on the retina. The vision is good at both distance and near. In astigmatism, the cornea is shaped like a football, so the vision is blurry at both distance and near. People with astigmatism are often used to seeing things distorted, so they can often guess the letters and even pass even though their vision's blurry. Astigmatism can occur alone or along with myopia or hyperopia. In myopia, the eye has grown too long, making the vision blurry at distance. Low myopes can often read better without their glasses than normal students, so eye doctors often encourage them to take their glasses off when doing prolonged near work. In hyperopia, the eye is too short. A person under 40 years old can accommodate or focus the lens in their eye and often see 20/20 without glasses. However, this can cause headaches, eye strain, difficulty reading, and tired eyes. Amblyopia or lazy eye is the leading cause of permanent vision loss in people under 40 years old. An eye or eyes are lazy if something prevents the eye from learning how to see 20/20. When most people think of lazy eye, they think of strabismus because it's obvious when an eye crosses or drifts out. But strabismus only accounts for 20% of amblyopia. That's because the strabismus must be fairly constant in only one eye to cause vision loss. If the strabismus is intermittent or alternates eyes, then amblyopia usually won't occur, but it may cause other symptoms. 80% of lazy eye is actually caused by high amounts of refractive errors such as astigmatism, myopia, or hyperopia. If the child gets glasses early enough, usually the permanent vision loss can be corrected. Less than 1% of amblyopia is caused by an obstruction such as a cataract or droopy eyelid. A person with strabismus may pass a vision screening with 20/20, but have other symptoms such as poor concentration, headaches, blurry or double vision. When the eye is strabismic, the person either sees double or suppresses or shuts off the eye. If strabismus is suspected, the child should be referred. In this video, we have only discussed vision screenings using a distance eye chart, since this is the most common method by far. That's because it's inexpensive, fast, and easy to train screeners. The biggest disadvantage is it only tests distance vision, so you can miss many problems. Therefore, if there are any other symptoms of a vision problem, it's better to refer them out. Titmus and Keystone telebinocular screeners try to incorporate a whole battery of tests to circumvent that problem, but I personally don't recommend these since they are expensive, take a long time, and tend to over-refer. The most accurate way to screen infants and 2 to 4-year-olds is an autorefractor screener. They are better at detecting low to moderate hyperopia or astigmatism than distance eye charts. Remember, treating amblyopia risk factors as soon as possible prevents permanent vision loss.
I hoped you enjoyed this training video. Remember, if you suspect a child has a vision problem, when in doubt, refer it out. Thank you and good luck on your vision screening.